Your doctor told you that you have a fatty liver and then said, exercise more and lose weight. That's it. That's the whole plan. Meanwhile, your liver is progressing towards something far more serious: inflammation, scarring, and eventually cirrhosis, while you're left Googling what to actually do about it. So today, I'm going to change that. I'm Dr. Kabir Haricharan Singh, a board-certified family medicine and obesity medicine physician. And in this video, I'm going to give you the specific foods, the right lab markers to track, and yes, the medications that actually have data behind them, so you can start reversing this in weeks, not years. Stay until the end because I'm covering two medications most doctors never mention to their patients with fatty liver, and one of them you've almost certainly heard of. Before we get into it, here's a quick disclaimer. Even though I'm a doctor, I'm not your doctor. This is educational information only, not personal medical advice. Always discuss decisions with your own doctor first. Okay, let's discuss what we're actually dealing with. The condition, now officially called metabolic dysfunction-associated steatotic liver disease, or MASLD, affects roughly 1 in 3 adults in the United States. That's not a niche problem, y'all. That's an epidemic hiding in plain sight. Kinda like a snake in the grass, if I may. What most people don't realize, and what most 15-minute office visits don't cover, is that fatty liver is not just a liver problem. It's your body's distress signal that insulin resistance, visceral adiposity, which is fat around the organs, and chronic metabolic inflammation are already underway. Now let's talk about the actual mechanism, because understanding why this happens is what makes the solutions make sense. The primary driver of MASLD is hepatic de novo lipogenesis, essentially your liver converting excess carbohydrates, particularly fructose, into fat. A study in the Journal of Clinical Investigation showed that fructose-sweetened beverages, not glucose, selectively drove fat accumulation in the liver and cholesterol dysfunction over just 10 weeks in adults who were overweight. Now, here's what makes fructose uniquely dangerous. Unlike glucose, fructose does not stimulate insulin or leptin, the satiety hormone released by your fat cells to tell your brain you're full. This leads to overconsumption and progressive leptin resistance, a state where your hunger signals become permanently dysregulated. The first tool in our arsenal is nutrition, and here are the 4 steps that make this approach work. Step 1. Eliminate the obvious offenders. The single highest yield dietary change you can make is eliminating liquid fructose. This means sodas, obviously, but also sneaky offenders like orange juice, apple juice, sports drinks, smoothies with added fruit, and even those heavily sweetened coffee drinks that seem more like a dessert than a coffee. Here's a practical example. A 12-ounce glass of orange juice has about 21 grams of sugar, nearly all fructose and glucose, with little to no fiber to buffer absorption. It's essentially a fructose infusion directly to your liver. The American Association of Clinical Endocrinology recommends staying under 24 to 36 grams of added sugar per day, but for patients with active MASLD, my clinical target is closer to less than 15 grams until we see meaningful improvement in liver enzymes and imaging. Also worth mentioning, dried fruits, like dates, raisins, prunes, and mangoes. These are essentially little sugar bombs. The volume that gave you fiber and fullness when eating a whole fruit is gone, which makes it easy to overeat and easy to overwhelm your liver. Step 2. Prioritize protein at every meal. One of the most underutilized tools in fatty liver reversal is protein optimization. Research has shown that a higher protein breakfast significantly reduced overall energy intake and craving for high sugar foods throughout the day. My clinical target for patients with MASLD is 30 to 40 grams of protein per meal 3 times a day. This range helps keep fullness hormones elevated, which suppresses appetite and reduces the drive to reach for processed carbs. The weight loss that follows from this approach is itself therapeutic. In fact, losing 5% of total body weight can decrease hepatic steatosis, and losing 7 to 10% of total body weight can improve inflammation in a more severe form of fatty liver called non-alcoholic steatohepatitis, or NASH. Step 3. Fat quality over fat avoidance. Now, here's where I push back against some of the low-fat dogma that dominated medicine for decades. The question is not how much fat, it's which fat. A study published in Diabetes and Metabolism compared overfeeding with saturated fat versus polyunsaturated fat and found that saturated fat drove disproportionately greater fat accumulation in the liver even when calories were equal. So practical guidance is this: keep saturated fats under approximately 5 to 7% of total calories and be mindful of red meat, processed meats, butter, and full-fat dairy, not eliminating them, but not over-consuming them either. Instead, choose monounsaturated and polyunsaturated fats like extra virgin olive oil, fatty fish, walnuts, flaxseed, and avocados. Step 4. Carbohydrate quality, not just quantity. You don't need to go zero carb to reverse fatty liver. What you need to do is stop eating high glycemic, highly processed carbs that spike insulin and flood the liver with the ingredients it needs to create fat, and choose low glycemic carbs, which produce slower insulin responses and less creation of fat in the liver. So focus on glycemic index and glycemic load. All right, next tool, exercise. If I could prescribe one thing that improves insulin sensitivity, reduces fat in the liver, and lowers triglycerides, it would be structured exercise. The guidelines from the American Association for the Study of Liver Disease, MASLD, recommend a minimum of 150 minutes of moderate intensity aerobic exercise per week, plus 2 days of resistance training. But resistance training may be especially important because it reduces liver fat independent of changes in body weight, meaning even if the scale doesn't move, your liver is getting healthier because your skeletal muscles improve how they get rid of glucose, and the liver decreases the amount of glucose it produces and puts back into circulation. Rule number 3, supplements and medications. Diet and exercise are foundational, but for some patients, we need additional tools, and that's where supplements and medications come into play. First up, vitamin E. The most well-studied supplement for MASLD is vitamin E at 800 international units per day. This was associated with a significantly higher rate of improvement of steatohepatitis compared to placebo, but I would recommend discussing the use of vitamin E supplementation with your doctor before taking it because high doses of vitamin E have been inconsistently associated with an increase in all-cause mortality as well as an increase in the rate of prostate cancer. Next up, omega-3 fatty acids. Omega-3 supplementation, particularly EPA and DHA from fish oil, has demonstrated reduction in liver fat deposition and improvement in liver enzymes in multiple randomized trials. Now, let's talk about medications by starting with pioglitazone. Name brand Actos, a medication that's often forgotten. Kind of like how my mom forgot to pick me up from school when I was a kid. Just saying. Anyhow, pioglitazone works by activating PPAR gamma receptors in peripheral tissues, which improves insulin sensitivity and reduces hepatic de novo lipogenesis. In the PIVENS trial, published in the New England Journal of Medicine, they tested pioglitazone head-to-head against vitamin E and found that 30 milligrams of pioglitazone daily produced significant improvements in steatosis, inflammation, and improvements in fibrosis. Likewise, a subsequent meta-analysis in the Annals of Internal Medicine confirmed that pioglitazone is one of the few medications that reduces hepatic fibrosis, the scarring stage of liver disease. The main side effects to be aware of with this medication are weight gain, fluid retention, which is why it's generally avoided in patients with heart failure, and a small increased fracture risk in women. But for the right patient, particularly someone who has type 2 diabetes, prediabetes, and NASH, this is a powerful and underutilized option. And now, the one you've almost certainly heard of, but probably not in the context of your liver, semaglutide, a GLP-1 receptor agonist, and the active ingredient in Ozempic and Wegovy. Beyond its well-known effects on blood sugar and weight, there are GLP-1 receptors in the liver and the gut-liver axis, and activation appears to reduce fat synthesis in the liver, improve insulin signaling, and reduce inflammatory cytokines. Data from the ESSENCE trial showed that semaglutide 2.4 milligrams weekly, which is the Wegovy dose, significantly improved fibrosis and NASH resolution in patients with stages 2 or 3 fibrosis. Y'all, this is landmark data. On a mechanistic level, a significant portion of semaglutide's liver benefit likely comes from its profound effects on weight loss. And as we discussed earlier, a 7 to 10% reduction in body weight is independently curative of NASH in many patients. But the GLP-1 receptor's direct effect on the liver appear to add benefits beyond weight loss alone. For patients with MASLD plus obesity, prediabetes, or type 2 diabetes, semaglutide is now a serious consideration and definitely warrants a conversation with your doctor. You shouldn't be waiting for your liver to hurt before acting, so here's what I monitor in patients with MASLD. First is a liver panel, looking at ALT, AST, GGT, and an AST to ALT ratio, metabolic markers like fasting insulin, fasting glucose, A1C, a full lipid panel, calculating a FIB-4 score, which is a validated non-invasive calculation that predicts the likelihood of advanced fibrosis. This is now recommended by AASLD as a first-line tool, by the way. Now, let me mention liver imaging. A liver ultrasound is usually done first because it's widely available and can detect fat in the liver when greater than 20 to 30% of liver cells are affected. For more precise, non-invasive imaging, a fibroscan, also called elastogram or MRI-PDFF, is done to provide a liver fat percentage and assess stiffness, which is a proxy for fibrosis. So if you've been told that you have fatty liver and sent home with generic advice, you deserve better than that. With the tools that we have available and what we've discussed already, this condition is reversible, but it requires a personalized, proactive approach that most 15-minute appointments can't simply deliver. If this video gave you something that your last doctor's visit didn't, hit subscribe, leave a comment, and share it with others who you think need to hear it. I'll see you in the next one.